Sponsored by the Carpal RX. If you have carpal tunnel syndrome, you already know what the symptoms are. You find it difficult to work or use your hands because of pain in the hand or in the wrist, numbness, burning or tingling in the fingers. Maybe you've already gone to your doctor who examined you and confirmed you have carpal tunnel syndrome. Your doctor likely gave you two treatment options, surgery or non-surgical therapy. In considering carpal tunnel surgery, the large number of people who have this surgery every year should not obscure the fact that such surgery is very risky. These risks include reaction to anesthesia, excessive bleeding, nerve damage, failure of the surgery, permanent hand weakness, infection, delayed healing, loss of job time, scarring, and even death. The average person believes that the answer to their carpal tunnel syndrome is surgery, but the fact remains that over half of people who have carpal tunnel surgery are dissatisfied with their results. This is in stark contrast to the great majority of people who are satisfied with their non-surgical therapy for carpal tunnel syndrome. In fact, your doctor should tell you that the American Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical therapies first before considering surgery. Your most effective non-surgical options fall into two categories. Resting your hand and wearing a splint are very important. Try to avoid the activities that caused your hand pain in the first place, like office work, typing, and writing. Next, find a brace or splint that you can wear that is comfortable. Make sure it's adjustable to your hand size, and more importantly, make sure that you can use it at night while you sleep. Make sure that you don't try to wear a brace while you do office work, like typing. This is one of the worst things you can do for your hand. Deep tissue massage therapy is proven time and again to be nearly 100% effective in relieving symptoms. But it's only effective if you use it daily for 2 to 4 weeks. Visiting a therapist only once a week for massage therapy is worthless. So how do you get this effective deep tissue massage daily without visiting a therapist daily? The answer is the Carpal RX. If you have carpal tunnel syndrome, then you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.